Good day, I'm Kathy King V. Handog, and today I'm going to discuss about the epilepsy. So, in this video, you will know what is epilepsy, what are the types of seizures, and what are the strategies of a teacher to help a student having an epilepsy. There are also more information about epilepsy that I include in this video, so I hope that you're gonna watch this until the end. Thank you. So let's start this video knowing what is epilepsy. So epilepsy is sometimes called a seizure disorder, a disorder of brain. A person is diagnosed with epilepsy when they had 2 or more seizures. So let us know the 2 types of seizures. Number 1 is the generalized seizures, and number 2 is the focal seizures. So what is generalized seizures? So generalized, according to my research, generalized seizures occurs when the abnormal electrical activity causing a seizures begins in the half hemisphere of the brain at the same time. So generalized seizures include absence, atonic, tonic, clonic, tonic-clonic, myoclonic, and febrile seizures. So we will discuss those seizures that I have said. So loss of consciousness may be accompanied by spasms, stiffening, shaking, muscle contraction, or loss of muscle tone. So what is the different types of generalized seizures? So there are types of generalized seizures. These are the absence seizures, atonic seizures or drop attacks, myoclonic seizures, and tonic and clonic seizures. So first, let us know what is absence seizures. Absence seizures is also known as petit mal seizures. These are staring spells that start suddenly and may be mistaken for simply daydreaming. The person having an absence seizures will typically stop moving and stare in one direction for 15 or less. So the second one is the atonic seizures or the drop attacks. These seizures or this type of seizures involves a sudden decrease in muscle tone, causing a person's body to go limp, slump, or collapse, possibly causing an injury. Atonic seizures characterize certain epilepsy syndromes such as Lennox-Gastaut syndrome. The third one is the myoclonic seizures. The myoclonic seizures are characterized by a sudden body jolts or increases in muscle tone as if the person had been jolted with electricity. So a myoclonic seizure is similar to a single or multiple sudden jerks people sometimes experience as they are falling asleep. So sleep myoclonic jerk are begin, whereas myoclonic seizures can be harmful since the jolts occurs in both. So there are subtopics. So there is one subtopic of a myoclonic epilepsy. These are the infantile spasms. So this typically begins between the age of 3 and 12 months of age and may persist for several years. Infantile spasms typically consist of a sudden jerk followed by stiffening. Often the child's arms flying outward of the knees pull up and the body bends forward. So each spasm lasts only a second or 2, but they usually occur close together in a series. Sometimes the spasms are mistaken for colic, but the cramps of colic do not typically occur in a series. Infantile spasms are most common just after waking up or falling asleep. This particularly severe form of epilepsy can have lasting effects on a child and should be evaluated and treated promptly. Last, the tonic and clonic seizures. In a tonic seizure, a person muscle stiffening and they lose consciousness. The eyes roll back in their head and muscle of the chest, arms and legs stiffening, causing the back to arch. The contracting muscle in the chest make it hard to breathe, and the person's lips and face may turn gray or blue. The person may be gargling sounds with struggling to breathe. The clonic seizures cause a person's muscles to spasm and jerk. Muscles in the elbow, legs, and neck flick and then relax in a rapid succession. The jerking motion slows down as the seizure subsides and finally stop altogether. As the jerking stops, it is common for the person to let out a deep sigh before resuming normal breathing. So tonic-clonic seizures are also known as the grand mal or the convulsive seizures, occur when tonic and clonic movements happen at the same time. Though witnessing a seizure can be frightening, it is a myth that a person having a seizure is in danger of swallowing their tongue, which is not anatomically possible. Never put a thing in mouth or forcefully open tightly clenched jaw while the seizure is happening, as this could harm the person. A seizure typically lasts a few minutes or less, after which the person is likely to remain unconscious for a few minutes more, depending on the intensity of the seizure. So this is the post-seizure or the post-epical period, and during these phases, the person's brain is extremely active as it tries to contain the abnormal electrical impulses and bring the seizures under control. People regain consciousness after a seizure are likely to be sore, confused or frightening, and very tired, providing assurance and support in the best help and observes and offer. So now let us know the focal epilepsy. So focal epilepsy is a neurological condition in which the predominant symptom is reoccurring seizures and affect one hemisphere or half of the brain. What you need to know. So, you need to know that focal epilepsy are characterized by seizures arising from the specific lobe of the brain. Focal epilepsy include idiopathic location-related epilepsies or ILRE, frontal lobe epilepsy, terminal lobe epilepsy, parietal lobe epilepsy, and occipital lobe epilepsy. So focal epilepsy may be treated with medications and occasionally with diet, nerve stimulation, or surgery, especially if the condition is due to a scar or the lesion in the brain. So, epilepsy is a complex disorder that has an impact on the many aspects of child's development and functioning. As a result, many of these children are at risk or unsuccessful school experiences, difficulties in social engagement with peers, inadequate social skills, and poor esteem. It is therefore important that a partners between educators, us, family members, and healthcare providers be instituted so that a plan for academic success as well as a plan for safety, management of emotional or behavioral dysregulation, and active social integration be developed and evaluated on an ongoing basis. So here are the suggested teaching strategies that will help a teacher on how to deal students having an epilepsy. Number 1, cooperative learning. So group work involves listening and talking skills, encourages interaction with peers in problem solving, and allows students to ask questions and learn from each other. Task analysis. The breaking down of specific tasks into their most basic steps establishes teaching and learning stages that will need to be achieved if the student is to succeed. Task analysis can be applied to any learning or social situation. Cueing proves effective especially with listening activities. Tell the student ahead of time of the purpose of the activity. Give a quick summary of a passage and ask comprehension question before reading the passage. Knowing the purpose of the activity will help keep the student on task. Reviewing. A review of purposes used in solving a complex task can be very helpful for students. Repetition leads to consolidation of skills learned in mastering a task, and consolidated skills are not likely to be generalized to other learning tasks. Mnemonics use verbal, visual, and symbolic techniques as memory aids. The acquisition of facts and procedural knowledge is governed by memory, and the most effective measures for memory development are rehearsal related. So that's all for my video, and I hope you learned something from epilepsy.